Hi, this is the 9 months follow-up and for Chris, and we are doing a month-to-month follow-up. Again, he had his result and quite drastic result around 4 or 5 months. Again, it's pretty rare to have an early result. And again, the audience want to know what's it look like, 1 month, 2 month, 3 month, 4 month, up to a year. So we're gonna do up to a year, and then we skip that year and we do 16 months later. But I'm going to show the audience what Chris looked like before, and that was him. So get perspective so the audience will understand. He's pretty much bald, and he's a couple of straggler of hair there, but work our way toward the back, and completely look a different guy. And this is where he is now. And so let me ask you this: when you mentioned you were like 6'5" and all this stuff. So you must be mixed, right? You
Well, a little bit, yeah. My grandfather is
part French.
Part,
so you're
French.
part Caucasian and Asian.
Yeah.
And so I guess the Caucasian gene is the one that tend to cause hair loss most of the time. Although there are Asian that lose the hair too, but the majority of the time is the Caucasian side.
Right.
And yep. And then well, let's talk about what happened this past weekend.
So I was talking to you, of course, and I went out and had a few drinks with some friends, and I met this girl, and I came up and talked to her, and the first thing she said to me was like, "Hey, nice hair. I really like your hair." And of course, she never knew that I had a transplant. It's just that I styled it really nice and everything, and she loved the hairstyle. So I was impressed, and it made me happy because this is the first time someone noticed my hair first instead of my height. First thing she said, "Oh, I really like your hair. It's really nice."
So you're a hair guy now.
Yeah. I'm not.
It's a good feeling, right?
It is a good feeling. Yeah.
It came from you don't have hair, and suddenly you have a lot of hair.
Right.
And then people know you for the hair. It's made your weekend.
I definitely did.
And then and then how about the story about your barber would recommend?
Oh yeah. So anyways, I've been going to my barber for over 15, 20 years, and so she's seen many stages of my hair, and then she always knew that I wanted to have my hair restored, and she said it's probably the best results. Well, actually, it's the best results she's ever seen. And so there's this other client of hers that always wanted to get his hair done as well, and I told her, go ahead and give my number if he wants to check out Dr. Diep and come in for a consultation. And so he did call me, and we talked, and I went to see him, and he was like really amazed. He loved my hair, and this was, I think, was at the 5 months mark or 6 month mark, and his wife even complimented him on my hair, and how natural it looked and how thick and dense it looked. And apparently, he was very anxious, because he wanted to get it done right away, and he came to see you, actually, Dr. Diep, and I guess because you had a long waiting list, and so he decided to go to somebody else, which I was kind of like, wow, okay, well that's a shocker, but for you having a long waiting list, it must tell you something, right? It's like, hey, it's a good doctor, and people trust you. That's why, it's a longer waiting list. But for him, he's like, oh, I can't wait. He's just so anxious about it. And for me, when I first did my research, it wasn't about pricing for me. It was more about
the result.
The results, actually, exactly, and your artistic skills and recreating their hairline, because I've seen a lot of work done where the hairline didn't look good, and so the most of the things that people concentrate on the most is actually the hairline. And if you don't have a good hairline, people are gonna keep staring at it no matter how much hair you have on the top, right? Mm-hmm. And I've seen a lot of videos of yours, and where you had to fix a lot of patients from who went elsewhere. Mm-hmm. So for me, it wasn't about the pricing at all. It was about that. And I remember when I first set up an appointment with you, and then also put my down payment and everything. I had to wait for a long time, and I was like willing to wait. I was like, I'm going to wait.
Hey, you've been losing your hair for many years, not just one day.
Right.
So why you in a rush?
Yeah, yeah, exactly. So for me, it was like, okay, well, I'm going to still wait. I'd rather have it done right than just go somewhere else and just get it done, or just get on to another doctor the next day or next week and get it done. It wasn't about getting it done quick, you know, it's getting it done right.
Done right, and then you had to come back to do multiple surgeries.
Exactly, and a lot of people asked on the video I saw that if this is one or two sessions, this is actually one session, you know,
Yeah.
and had 5,200 grafts.
So yeah, it's just you can find crazy price online, but you know, and then in the end, it costs you a lot more in the long run, right, Chris?
Okay, yeah.
Because you know, some people open clinic just to make money. It's just a different story.
Right.
They don't care about the work or the result or how the patient feel. I mean, because it's a very very what do you call it? It's a very emotional step or a journey, but it affects you in a lot of ways, more than just physical, right?
Right.
Emotionally, and it's psychologically, and it's very stressful just to think about doing the surgery and to go through it and then doing the recovery, right?
Right, right.
And with the recovery, you say, oh, we're not gonna have good result, or how long will it take for me, and so. You know, it's a lot, so it's important, and that's why for me, when I do surgery, it just I put myself in the patient's situation and try to get the best result, because I was saying, hey, if I were the patient, I want the doctor to put a lot of effort and give me the best he can, you know,
Right.
because you know this is gonna affect me for the rest of my life. But you know, the other thing, I enjoy it.
Right.
That's my passion, and you do it every day, and you enjoy your work.
Mhm.
It comes out.
Right,
Yeah.
right. And I guess, you know, like I said, I was watching your videos, and after I got my hair done, you know, I can't help to look at it every day. I mean, everybody goes through it, and you know, you see the hairline, you see, you know, the different stages of your hair growing, and you know, you did a great job on my hairline. I couldn't stop looking at my hairline, and basically you recreated my hairline, right? But then I noticed, like, wait a minute, even though how nice it looks, I noticed that one side was slightly, you know, higher or shorter than the other side. I was like, wait, what's going on, you know? But then I realized something. I looked at my original hairline when I didn't lose my hair. My hairline wasn't perfect. It was, you know, slightly off. And I looked at all my friends and other people who never lost their hair. They still have a full set of hair, and their hairline's not perfect. And I realized that because of that, it makes your hair looks really natural, and that's really what a natural hairline is. It's not perfect, right? Mm-hmm. And I've seen some. Then I started researching. And I saw a lot of videos of where the hairline is just so straight or just so, you know, symmetric and everything. It looks really fake. So you know, I'm glad that, you know, you created the hairline exactly how it's meant to be. And as you can see now, you know, you can't tell if my one side is higher or shorter. It grows out perfectly and it grows in perfectly. So, you know. Yeah, that's what I realized about hairlines.
Yeah, you know, if you split your face in half, you're never gonna have your eyes and your eyebrows and all that stuff. It's uneven. It's not gonna be exactly the same. So you're not identical. And so in terms of hairline, you want to make sure that it's more imperfect.
Okay.
The more imperfect it is, the more natural it looks.
And yes, right, and people don't notice it as much, you know. Yeah.
And I have a lot of patients who really were nervous doing the recovery because they say, "Oh my God, one side is a little bit higher."
It's a natural reaction. I mean, that was my
It
natural
freaked them out.
reaction. Yeah, it freaked me out.
And they say, "Oh my God, doc!" You know, when right afterward, you see the red mark and
Right.
you see the demarcated line.
Okay.
But when the hair comes in, it's totally different.
Right.
It's so natural.
It fills in really well.
Yeah. And after that, you know. So in my potential client or the client who just did it and were nervous about uneven, just wait a year.
Yeah.
Wait a year, and after a year come and they still really bother you, then we can talk about fixing it. But a lot of time people will say, hey, you know what? Imperfectionness lead more to more naturalness. And
My right foot's you know, bigger than my left. You know. No, it's true. So you know.
Yeah.
So yeah, those kind of things. And plus, you know, I come in and talk to the ladies a lot, and they tell me a lot of times, you know, patient comes in, they're concerned, like, oh my God, you know, it's been 4 months and this and that. But then, you know what, after a year, they said, they come back and they apologize. Oh yeah, you know what, I was just anxious, and now my hair is great and this and that. So, so you know, I realize that, you know, as a patient, you know, we're all very anxious, you know what I mean? And of course, always, we're very, aware of every part of our body, and you know, especially after you got a hair transplant, you know, and you're just constantly looking at it, you know, you're looking for greatness, but all at the same time, you know, you're looking for, like, oh my God, you know, what just happened here? Is this supposed to happen or not, you know? So
you know, because we do this month to month, I do have a lot of clients text me, say, hey doc, this is 5 months, this is my 6 months. I was looking at Chris and his is so much more dense and all stuff. And you know, and I say, look, you know, just be calm down, because not everybody gonna react the same. Not everybody hair graft grow the same rate. So it take a year for it to fully grow.
Right.
And so be patient. If yours not, density as Chris 4 months or 5 months. Again, some people it will take up to a year or even a year and a half. Right.
I remember when I first came in, when I got my hair transplant, you told me the same thing. You told me, look, I go, what was my hair going to look back in 3 months, 5 months? You go, well, the worst is going to look is how, you look before your hair surgery, because it'll take some time. And I prepared myself saying, okay, well, you know what, I might not be the 5%. And lucky I was for myself, I was overjoyed, Yeah, couldn't be happier.
Okay. Again, we will do month to month, and
Right.
the next video is the 10th month, and then the 11 and the 12 months.
Right.
And I hope the audience gain some perception and understanding of what a typical client like Chris here going through. And some people go through different, but at least in understanding what's it like, and the journey is stressful, but it's very rewarding at the end, And some people might need one surgery, and some people might need a little touch up more. Just depending how aggressive hair loss you have, and what technique, and what type, and how much hair graft. So and depend on the graft too. The type of hair. Some people hair are thicker than others.
Right.
So.
And you know what? I want to kind of make a comment about your stressness. You know what? The experience, it's going to be what you make it. For me, it wasn't very stressful. You know what I mean? Because you put stress on yourself and you worry too much and whatnot. So that's something I learned. And I just let it go day by day. I trust in you. And when you did it, I said, hey, it's going to turn out great. And just let it be. But of course, there's going to be times when you will be like, oh my God, kind of worrisome. But, don't overstress, because, your results will eventually get there, and you'll be happy.
Now you have more volume now in your hair, huh?
Yeah, I just noticed. I looked in the mirror the other day. I go, oh wow, my hair is a lot thicker, and I'm leaving the sides. So before I was, as you noticed, I was shaving the side kind of close, but I'm kind of leaving that side a little thick and kind of gelling it back. And because I have a lot more hair now, I've been playing around with different hairstyles. I've been gelling it back, combing it this way, combing it that way. So it's filling in pretty well now. So
Great.
Yeah.
All right. So we're gonna do the 10th month next time. Stay tuned.
All right.
Thank you.
Bye.